Good morning. This is Veno here. I want to talk to you about treatment of mycotoxicosis in pigs. Now, just to give a little background about what mycotoxins are, these are secondary metabolites of mold growth in grains and forages. Is actually responsible for a lot of economic losses in various livestock industries around the world. In the US, for example, mycotoxins cost the US economy $1.4 billion. All right, so mycotoxicosis is a very, very important subject to look at, especially in pigs. Now, I'll just give a little background and then discuss about the treatment of mycotoxicosis in pigs. For example, you can see here one of the causes of mycotoxicosis is aspergillus, various species of aspergillus, and of course there are many other fungi organisms that can cause mycotoxicosis. One of the popular mycotoxins in pigs is a toxin called zearalenone. Zearalenone is responsible for certain clinical signs like vulvar swelling and vaginitis in pigs, and it can cause immunosuppression and does some damage to the liver, and in male pigs it can decrease the libido and cause infertility in sows. This is just an example of the many mycotoxins that affect pigs, and virtually mycotoxicosis affects almost every system of the pig. And the most common mycotoxins in pigs include ochratoxin. Ochratoxin will cause some renal lesions. We also have the zearalenone that I just mentioned right now. It can cause vulvovaginitis and prolapse. And then we have the ergot alkaloids, which can cause gangrene in the appendages. And then we have aflatoxins, which can cause hepatitis and various forms of liver damage. And then we also have some other mycotoxins like the fumonisin, which can cause acute lung edema. And then we have the trichotillins group of mycotoxins, which can cause things like oral irritation. They can even cause dermal or skin irritation. And we have vomitoxin, another toxin, which can cause feed rejection in pigs and can lead to vomiting in pigs. This slide also gives more details about mycotoxins in pigs. And we can also see that various other factors come into play when we talk about mycotoxicosis in pigs, such as the age, the sex, the species. In this case, we are talking about pigs, because animals like ruminants are less affected by mycotoxins than pigs. All right, so mycotoxicosis is very important in the pig industry, and that's why we need to talk about it. And so we've been discussing various aspects of mycotoxicosis. I want to briefly talk about treatment of pigs with mycotoxicosis. So if you visit a farm, for example, and you suspect that the pigs suffering from some form of mycotoxin, what are you going to do? All right, there are thousands of mycotoxins that can affect pigs, but these are the most popular ones. The aflatoxins, the ochratoxins, the trichoticins, the ergot alkaloids, zearalenone, and then fuminicins. These are the most popular mycotoxins, hopefully that you'll be dealing with in most pig farms. So if a pig has mycotoxicosis, what are you going to do? So the first thing I will say is that it is always better to prevent than to try to treat. You know, they say prevention is better than cure, right? So it is good to take care of feeds because the therapy for mycotoxicosis is not very effective, generally speaking. So it is better to ensure that the feeds are not having any form of mycotoxin in the first place. So if feeds are suspected to have some form of mycotoxin, you can treat the grains with sodium bentonite, for example, and also anhydrous ammonia to attempt to decontaminate the feeds of the mycotoxins that might be present in the feeds. And sometimes people take some of the feed that is already contaminated with mycotoxin and they try to mix it with feed that they're sure doesn't have any mycotoxin to sort of dilute the toxin of it works a lot of times, but most of the time we advise that those kind of feeds are not given to breeding stock of pigs. They can be given to pigs that are growing finishing pigs, you know, those ones that have just been kept for the pork, and that's all. But for breeding pigs, as much as possible, avoid feeding them with feed that we know is already contaminated with mycotoxins. All right, so again, like I have mentioned, that prevention is always better than cure because the various forms of treatment you attempt for mycotoxicosis are not very, very effective. In many cases, the pigs might not be responsive to the treatment. So, but generally, we do a sort of supportive treatment and symptomatic treatment. For example, if the pig is having aflatoxins, it's the cause of the mycotoxicosis, you can administer vitamin A, vitamin D, vitamin E, vitamin K, and the vitamins of the B complex. All right? So B complex vitamins can be given, and you can also attempt to treat against secondary bacterial infection, because when the immunity is compromised, all right, so bacterial infection can set in. So you can attempt to treat for secondary bacterial infection. All right, so but then again, these are just supportive treatments that you're given, because it doesn't directly handle the mycotoxicosis. But when you administer this treatment, we hope that with time the body's immune system will pick up and will be able to fight the toxin off. Now, if the animal is having ochratoxin, mycotoxicosis, there's little you can do, because there is no specific antidote for the ochratoxin, and all you can do is supportive treatment. Maybe give some dextrose saline, some multivitamins, and lots of water ad libitum for the animal to drink, and hope that the body will be able to fight the infection. Now, but if you're dealing with trichoticins, mycotoxins, there is something you can do to this group of mycotoxins, right? Under the trichoticins, toxins, we have toxins like the T2 toxin. We also have the diacetoxycypenol toxin, and then we also have the deoxynivalenol toxin. Now, this group of toxins are quite an interesting group of mycotoxins, all right, because some form of treatment is a little bit effective, and that is the use of anti-emetic drugs, because these trichoticins will cause the pigs to vomit a lot, all right. Now, if you want to handle that, you need to administer antiemetics, but not just any kind of antiemetic, specifically antiemetics that are effective antagonists of serotonin, right? Because during trichoticins, mycotoxicosis, there is elevation of serotonin and tryptophan, okay? So for you to be able to control it, you need to administer antiemetics that are antagonists of serotonin. Okay, examples of those kind of antiemetics are ondansetron, for example, ondansetron. Another example is granisetron. Granisetron, they are good antiemetics that are antagonists of serotonin, right? So they can be administered, okay? Now, if you are dealing with another form of mycotoxin, like the ergot mycotoxins, you need to remove the gangrenes from the appendages, and you will need to, of course, treat for secondary bacterial infection, all right? Now, if you're dealing with another mycotoxin, like zearalenone, if you're dealing with zearalenone, you would need to do some little surgical intervention to correct a prolapse, because zearalenone will cause things like rectal and vaginal prolapse, all right? So you will need to do some form of medical and surgical intervention of a sort. And I've already mentioned about ergot, you will need to remove the gangrene. So when you do these procedures, generally you will need to administer antibiotics. Antibiotics to control secondary bacterial infection that might set in, all right? So you can see actually that when you're talking about treatment of pigs with mycotoxicosis, you discover that there is no specific antidote, against mycotoxicosis. So because there is no specific antidote, you will need to be very careful to ensure that the condition doesn't arise in the first place. You will need to be very careful in the farm to ensure that you don't give room for mycotoxins. That means you don't give room for fungi to produce secondary metabolites that will release toxins and that will affect the feed that will be fed to these pigs. And of course, you know that certain conditions are very ideal for the production of mycotoxins. One of the most important is moisture. The moisture is conducive for fungal growth. Of course, fungi will grow, and then they will produce secondary metabolites, toxin, and when the feed is prepared for the pigs, you have these mycotoxins in the feed. And generally, mycotoxins have very serious effects on pig production. They are carcinogenic, they can lead to retarded growth of the pigs, or slow down the growth of the pigs. They can even